Whether it was brought on by arthritis, nerve damage, bending the wrong way, or lifting something a little too heavy, lower back pain can be frustrating to deal with. But if you're struggling, know that most people experience back pain at some point in their lives, and it's one of the most common reasons people book doctor's appointments and call out of work. In fact, it's one of the leading causes of disability worldwide, according to the World Health Organization. Hi guys, welcome back to our channel. In today's video, we'll converse about the 10 best treatments for lower back pain. Treatments for lower back pain relief range from simple to complex, and the right course for you depends on how long you've been hurting, the severity of your pain, the location of your pain, and whether your pain is structural or muscular. If your back pain just started, consider slacking off just this once. In most cases, back pain resolves in 1 to 2 weeks, says Justin J. Park, MD, a board-certified orthopedic spine surgeon with the Maryland Spine Center at Mercy Medical Center in Baltimore. However, other factors like your age and activity level could cause back pain to last for up to 6 weeks, he says. People who don't pursue extreme treatment tend to have fewer complications than those who end up rushing into invasive treatments before it's truly necessary. But of course, the thought of wasting over a month for your pain to subside may feel unbearable. Here are the best lower back pain remedies to find relief fast. Number 1. Reach for anti-inflammatory drugs. Even as you practice patience, a non-steroidal anti-inflammatory drug, NSAID, such as ibuprofen, Motrin or Advil, or naproxen, Aleve, can help reduce the back pain you're pushing through. The research behind medicine guidelines for lower back pain finds that these may give slightly better relief than acetaminophen, Tylenol. Most of the time when you have back pain, it's a muscle or ligament strain, and inflammation you have is helped by an anti-inflammatory, Dr. Park says. Over long periods, NSAIDs can cause gastrointestinal problems, so Dr. Park recommends that you don't take them for more than 10 days without consulting your doctor. Chronic back pain is an important health problem. Non-steroidal, anti-inflammatory drugs are widely used to treat people with low back pain, especially people with acute back pain. Short-term NSAID use is also recommended for pain relief in people with chronic back pain. 2 types of NSAIDs are available and used to treat back pain: non-selective NSAIDs and selective COX-2 NSAIDs. In 2008, a Cochrane review identified a small but significant effect from NSAIDs compared to placebo in people with chronic back pain. This is an update of the Cochrane review published in 2008 and focuses on people with chronic low back pain. Number 2. Find relief through ice and heat. Break out that bag of frozen peas or a cold pack if you want to get fancy for the first 48 hours after the pain sets in, and put it to use for 20 minutes a session, several sessions per day. After those 2 days are behind you, switch to 20-minute intervals with a heating pad. Localized cooling shuts down capillaries and reduces blood flow to the area, which helps ease the swelling, says Lisa DeStefano, DO, an associate professor at Michigan State University's College of Osteopathic Medicine in East Lansing. Cold also thwarts your nerve's ability to conduct pain signals. Heat, on the other hand, loosens tight muscles and increases circulation, bringing extra oxygen to the rescue. Topical application of ice or heat therapy can bring a surprising level of pain relief for most types of lower back pain. Heat and/or cold therapy is beneficial either as a primary or adjunctive therapy, but people often overlook this treatment because it's simple, inexpensive, and readily available. Number 3. Wear supportive shoes. Some back trouble starts from the ground up. Wearing heels can be tough on your back, and that's especially true if you tend to wear heels for hours at a time, Dr. Park says. It causes you to arch your back more, he explains. If you don't want to give up your heels, Dr. Park recommends wearing flats or sneakers while you're in transit and keeping your heels at work or carrying them in your bag. And when you can, throw some flats into your regular footwear rotation instead of heels. When it comes to back pain, the footwear you choose has a strong influence. Choosing footwear that is supportive, comfortable, or recommended by doctors can help to reduce the amount of pain you feel day to day. Wear high heels and flip-flops sparingly and reach for supportive tennis shoes to elevate the pain. Number 4. Look into getting a new mattress. How old is your bed? You may be surprised to learn that the average lifespan of a mattress is less than 10 years. There's no hard and fast rule, says Sean McKay, MD, PhD, Chief of the Division of Pain Medicine at Stanford University. But if your mattress is sagging significantly or is more than 6 to 8 years old, I'd think about getting a new one. In fact, there's no specific mattress that's best for your back pain. Instead, People with back pain should look for mattresses that feel medium firm, however you define that, because those beds have the best chance of reducing both soreness and stiffness. Number 5. Do gentle stretches. Gentle stretches, walking, and periodically standing up at your desk can help stabilize your spine and prevent muscle imbalances. And despite how hard it is to imagine doing downward-facing dogs with a bad back, yoga can work in your favor too, says Neil Anand, MD, professor of orthopedic surgery and director of spine trauma at Cedars-Sinai Spine Center in Los Angeles. Not only is it almost zero impact, but the poses and stretches performed in yoga can be very therapeutic, he says. Dr. Anand recommends stretches like cat-cow and child's pose to upward-facing dog to downward-facing dog. Repeat these 5 or more times a day, and you might just notice some positive changes in your spine, your posture, and your overall well-being, Dr. Anand says. Lie on your back with your legs straight and your heels on the floor. Bring your right knee to your chest, using your hands to pull your knee gently. You will feel a stretch in the front of your left thigh and lower back. Keep your left knee straight and hold for 5 to 10 seconds. Number 6. Ask about prescription medications. If your back pain has not resolved itself within 4 to 6 weeks, make an appointment with your doctor who will examine your back and ask you to sit, stand, bend, walk, and lift your legs to see how your pain is affecting your mobility. You'll likely be asked to rate your pain on a scale of 1 to 10, and they may do imaging tests like an X-ray or MRI. Then, he or she may recommend one of the following prescribed therapies. Muscle relaxants. Medications like cyclobenzaprine or baclofen can help relieve painful back spasms. If you go this route, just know that side effects can include fatigue and dizziness. Topical pain medications. These creams and ointments, like Voltaren gel, are meant to be rubbed directly onto the area that's hurting you. Cortisone shots. If other treatment measures fail, your doctor may recommend an injection of cortisone, a potent anti-inflammatory. There are risks, including thinning of nearby bone, and relief typically lasts just a few months, tops. Number 7. Consider physical therapy. A physical therapist will teach you stretches to manage your back pain, as well as exercises to correct any imbalances that might have brought on pain in the first place. Depending on the causes and severity of your back pain, your PT may also employ other treatment techniques, such as ultrasound, electrical stimulation, and active release therapy. Physical therapy is best for back pain when people have an episode once or twice a year, Dr. Park says. It helps to strengthen core muscles and back extensor muscles. Most types of lower back pain are often referred to physical therapy as one of the first-line treatments. Physical therapy for lower back pain includes guided therapeutic exercises that strengthen the lower back muscles and condition the spinal tissues and joints. The short and long-term goals of physical therapy for back pain typically include the following: decrease painful symptoms in the lower back and/or leg, improve low back function to tolerate daily activities as independently as possible, increase the spine's flexibility and improve its range of motion, formulate a maintenance program to prevent the recurrence of back problems. The exercises are intended to provide flexibility and strength training to the entire kinetic chain, groups of body segments, joints, and muscles that work together to perform bodily movements. Physical therapy helps restore the patient's ability to perform daily activities with little to no discomfort. Large-scale studies have shown that physical therapy can provide up to 60% improvement in lower back pain and other symptoms. Number 8. Experiment with acupuncture. Acupuncture may provide even more relief than painkillers, according to one 2013 review of research. In 11 studies of more than 1,100 people, this Chinese medicine staple improved symptoms of lower back pain better than simulated treatments and, in some cases, NSAIDs. The needles appear to change the way your nerves react and may reduce inflammation around joints, says Dr. DeStefano. Number 9. Book a massage. There's an upside to your discomfort. It's a legit excuse to get a weekly massage. One study found that people who did had less lower back pain and disability after 10 weeks compared with people receiving standard medical care. And general relaxation rubdowns worked just as well as structural massage targeted at specific parts of the body. Still, after a year, all the participants saw similar improvements. My advice to patients is that if you get a massage and it helps, that's great, Dr. Park says. So much back pain is due to muscle strain. Number 10. Try to boost your mood. No, the lower back pain isn't in your head, but obsessing over it could be making it worse. Fear, anxiety, and catastrophizing can amplify pain, says Dr. Mackey. Because brain circuits that process pain overlap dramatically with circuits involved with emotions, panic can translate into actual pain. Start by accepting that you have pain, Dr. Mackey says. Then say to yourself, it will get better. If you struggle with overall mental well-being, say you have anxiety or depression. In addition to your physical aches, it could be worth seeing a therapist to manage negative thought processes while exploring other lower back pain treatments. If you try the treatments here and don't see any improvement or still feel pain, talk to your doctor about a referral to a pain management specialist, as more specific tests or treatments may be required to get to the bottom of what's going on. I hope this video added some value to your thoughts. Do share your views in the comment section below. If you haven't subscribed to the channel yet, please do so and hit the notification bell. See you in the next video.